first scenario?
That's the first one is Terry Butcher, he was a footballer and banged his head, got a deep gash on his head. So this happened when he played for England in the World Cup in 1989. He caused a deep gash on his forehead. The physios came on, they stitched it, lightly stitched it, but obviously the bandaging came off because he was playing a full contact sport. So by the end of the game he was covered in blood, so that comes under the signs and symptoms, which are dizziness, bleeding, vomiting, swelling, headache and prolonged confusion. And obviously experienced several of these: swelling, bleeding, headache, but he was still able to finish the game. The first aid treatment he received was Pricer, so he protected himself by putting the bandage on his head. Didn't really get much rest because he carried on to play the game. However, after the game he will have obviously had it properly looked at. Briefly iced it to reduce any swelling. It was compressed with the bandage. It's his head, so it's already elevated, and he was already referred on the spot to a physio.
Good.
So common treatments for minor head injuries such as bumping or banging heads, like in this case, can normally be treated with ice, rest and compression. Assessing the injury is very important and see if it can worsen, so this will be done after the football match to make sure there's no concussion or anything. So Terry Butcher's injury, or banging your head off a rock or falling from height, medical assistance should be sought quite quickly, and surgery might be required if it's a severe case. So that's it for head injury.
Great stuff. Next
So next
scenario.
one, done the ruptured ACL of Michael Owen, who was also a footballer. So he was playing for the World Cup and he went over on his knee, causing his anterior cruciate ligament to rupture. It was caused by pivoting or landing on his knee, which he did awkwardly, obviously, as you can see in a video if you watch it. Can even be caused by high impact collisions with other players. Signs and symptoms: often a loud pop can be heard when the knee goes, and a sudden shift in the joint can be felt, so it gives way beneath you. And swelling occurs quickly after the ACL ruptures because the knee fills with blood, and pain is often felt and varies in intensity based on severity for swelling of the joint. First aid treatment for this would be salt taps. So obviously you'd see the injury occur, heard it pop, saw it was out of place. So the physio would come on, ask him about the injury, ask him where it hurts, let's say his knee. They'd look at the injury, assess its severity. It was obviously severe enough to have him stretch it off. They'd have touched it to assess it, see how much it was swelled. Ask them to try and move it, see what the range of movement is. Try and move the person, which we did in the stretcher. Assess its strength, see if they can assess it visually or if another treatment needs to be used. They'd protect it, so splint or bandage it up. Rest is important so we can rehabilitate the knee over time. And then obviously use ice, compress, elevate and then refer, like in Pricer. So common treatments are usually used to reduce swelling straight after, like ice compression and elevating the knee. Gentle compression can sometimes be required, and crutches should be used to keep weight off the affected knee so it's got sufficient time to recover. Physical rehab programs can be followed weeks later when the knee is fully recovered, which will help restore the full range of movement, which can be used for various stretches. Obviously surgery will be needed if the injury is bad.
Great stuff, well done. Next scenario.
Next to shin splints, Beth Tweddle, who was a gymnast. So it was caused for excessive pressure being placed on the lower leg muscles, which obviously caused it to become really inflamed and swollen. And the high impact being put on the muscles caused by the intensity of the sport she participates in. So obviously she's on the balance beam, she's doing somersaults, she's going to be putting a lot of pressure on a daily basis onto the joints, which is going to cause the shin splints to happen. Repeated performance will cause the shin splints to become worse, so rest should be taken. Symptoms include pain along the inner part of the lower leg, tenderness or soreness along the inner part, a degree of swelling in the lower leg, and it might even feel numb and weak due to the swollen muscles irritating different nerve endings. So once again, Pricer. So you protect yourself, rest, ice, compress, elevate and refer. So all of these are used to help reduce the swelling in this case, and then the compression to stop it from spreading.
Good.
Common treatments for shin splints tend just to be doing a lot of rest and not doing any exercise or putting weight on the leg for a couple of weeks, but depending on severity, time can vary. Applying an ice pack to the shin and keeping it elevated can reduce the swelling and reduce the time that it might take for the leg to recover. After a week or so, gentle stretching can be used to aid the leg's rehabilitation. There should be no pain performing these stretches, so obviously it should be stopped if pain's felt. It should be done until the leg can be used again, or can be resumed without pain.
Good stuff.
That one. So
Next one.
finally, Serena Williams shoulder sprain. So she strained her shoulder through repetitive strenuous tennis playing. The muscle strained because the movement was too much for the muscle to cope with. So obviously repeated hitting the ball puts a lot of pressure and strain on the shoulder, caused it to strain. Symptoms include pain around the affected joint, being unable to use the joint normally or being able to put weight on it, bruising, tenderness. In this case, obviously, you couldn't hit a tennis ball. So once again, Pricer, protect, rest, ice, compress, elevate and refer. That's the best thing to do for strain because obviously there's a lot of swelling. Rest is important as it needs to recover. So most treatments, sprains can be self-treated at home. The easiest way to treat a strain is to rest it between 2 to 6 weeks depending on severity of the injury. Ice can be used to reduce any immediate swelling and pain, and elevating the injured joint can help as well, or muscle. Support bandages can be used to help support the affected area if the strain doesn't get better. If the strain doesn't get better, then medical assistance should probably be sought.
Excellent, well done. Quick question. For each one, is it acute or chronic?
So a shoulder injury for Serena Williams will be chronic, it's going to last for over a period of time.
Good.
Terry Butcher's acute because he did it right on the spot.
Good.
Michael Owen's acute, did it right on the spot. Shin splints is chronic because it's over a period of time.
Excellent. Well done, James.